Everyone, it's a medical care plan on hypertension. We have to make front weight like this. I write for chronic bronchitis. This medical care plan, especially for PhD second year. On the first page, we are going to write about the introduction of that particular disease condition. As I have hypertension, so I write as a part of my medical surgical clinical posting at particular hospital, which for hospital you are going for clinical duty. You have to write that name and where you posted. Like I posted on medical ward, so it's my introduction, and I assigned for my patient who their date of birth and year are that, what is his like diagnosis क्या क्या थी उनकी, वो सब लिखेंगे हम। फिर यहाँ से हम पेशेंट असेसमेंट स्टार्ट करते हैं। पेशेंट के बारे में हम डाटा लिखेंगे। पेशेंट का नाम क्या है, एज, सेक्स, ये सब पूरा लिखना है। फिर यहाँ पे है हिस्ट्री ऑफ इलनेस, लाइक उसकी हिस्ट्री जानेंगे। तो मेरा सिर्फ कंप्लेन है, मेरा सिर्फ कंप्लेन में था जगन्नाथ रेड्डी हैं। इनका कंप्लेन था लाइक नोजिया, फटीग, डिजनेस और शॉर्टनेस ऑफ ब्रीदिंग हो रही थी इनको। पेशेंट का फिर लिखेंगे पास्ट मेडिकल हिस्ट्री। इसमें लिखेंगे पास्ट मेडिकल हिस्ट्री क्या था पेशेंट का, लाइक उनको इससे पहले कोई बीमारी हुई थी। देन वी आर गोइंग टू राइट अबाउट पास्ट सर्जिकल हिस्ट्री, पास्ट सर्जिकल हिस्ट्री, देन प्रेजेंट मेडिकल हिस्ट्री। Here, after present medical history, we are going to write about present surgical history. अगर उसको कुछ सर्जरी करने जा रहे हैं तो उसके बारे में लिखेंगे, नहीं है तो कोई लिखने की ज़रूरत नहीं है। Then we are going to write about personal history, hygienic, person is hygienic or not. Health habit like how much hour he was sleeping, he was her sleeping or her or his sleeping pattern. Elimination habit like bowel elimination pattern or urine elimination pattern. Other habit like a habit of smoking. Have you he was if you are smoking, like how much stick you are smoking. So my patient was hypertension, so he was smoking and he used smoke 4 stick per day since 2 to 3 years. Next, next is socio-economic history. Like my patient, Raghunath Reddy, he was a software engineer and he was earning around 80,000 per month, and he having well house and drainage, ventilation system, all are good, and electricity supply all are good because he was earning it's around good enough money for month. Family history. In a family pedigree genogram, we have to write for 3 generation, but here we are representing only for 2 generation, like how many person are living in home. So my patient Jagannath Reddy are staying in the nuclear family, and he was staying with her wife and 2 children. Jagannath Reddy was 38-year-old patient, and education is BTech, occupation software engineer, and healthy. This is my patient family composition, and this is my family pedigree. Jagannath Reddy father name is Somnath Reddy, and Somnath Reddy have two son, Pushpanath Reddy and Jagannath Reddy. And Jagannath Reddy married with Apurva Reddy, and he having 2 child. One is Vikrant Reddy and Meena Reddy. Nutritional history of the patient, like my patient non-vegetarian, and he was taking milk twice a day. Physical examination, we are going to write about the physical examination, like whatever, right? Then height and weight, mental health assessment, then vital signs, incumbent system. So it's not completed yet, but I make a video which is very useful for you. Uh, Here I wrote about the nails, ears, head, face, and eyes. Here I wrote about the nose, mouth, tongue, ears, and neck. Neck, random motion, flexion, lymph node, thyroid. Here I wrote about pharynx, chest, uh, abdomen. In chest, we have to write about inspection. We are inspecting the breathing pattern, like पेशेंट जो है हमारा, वो ब्रीदिंग पैटर्न कैसा है, नॉर्मल है, एबनॉर्मल है, ब्रीथिंग रेट कैसा है, उत्तर रेट में कुछ प्रॉब्लम हुआ तो भी लिखेंगे हम। रेट ऑफ पल्स रेट इनका ज़्यादा है, 85 है, लाइक नॉर्मल होता है 60-90 होता है, पर 85 इट क्वाइटली हाई, इट्स लाइक नॉर्मल बट क्वाइटली हाई है, अगर ज़्यादा हुआ तो दिक्कत हो सकता है। एब्डोमेन का लिखेंगे, फिर बैक और लोअर लिम्ब, बैक स्पाइन, जेनिटल, रेक्टम एंड रेक्टम। Now we are going to make a investigation. First, we have to do investigation for hypertension patient. First, we are going to measure blood pressure. Patient finding is around 150 by 90 is around 90, but I don't know, 150 by 90 mm at the, and our finding 125 HT. It's abnormal because for the hypertension patient, or we have to measure blood pressure for 2 or 3 times, because maybe sometime it's happen, it will come wrong. So we have to read for 2 3 times. Renal disease, normal pH level is around 4.5 to 8, but patient have standard rate. Blood cholesterol level less than 200 mg per deciliter, but blood pressure level is quite high on patient. Electrolyte level, sodium level, as we know, sodium is quite high on hypertension patient, which can lead to hypertension. Normal sodium level is 135 to 145 milli equivalent per liter, but patient have 155. Blood sugar level 160 730 is a low, and this is medication. First, we give diuretic as a Lasix, is furosemide. Yeah, this is an antihypertensive drug, and which lead to uh, रीजन लाइक यूरिन पास करने में हेल्प करेगा, ये वाटर को रिएक्शन नहीं करेगा, ये वाटर को पास करेगा बॉडी से. दिस इज बेंजाप्रिल हाइड्रोक्लोराइड. ये एक्ट करेगा डायरेक्ट एंजियोटेंसिन पे, और ये ब्लड प्रेशर घटाएगा. बीटा ब्लॉकर एटिनोल, ये ब्लॉक करेगा बीटा 1 रिसेप्टर को. कौन मेडिसिन क्या क्या है और कैसे देना है. ओडी में हो गया वंस टाइम और वंस अ डे. बीडी मीन्स ट्वाइस अ डे. Nursing diagnosis. First, we have right risk to decrease cardiac output leads to various condition as evidenced by physical examination. This all are my nursing diagnosis. This is my nursing care plan. Subjective data, diagnosis, goal, planning, rationale, implementation, evaluation. Assessment दो आएगा. Subjective data, like patient, what patient is saying. Objective data, what as a nurse we are identifying in the patient. Diagnosis, on after that objective data we are going to diagnose the patient condition. Goal, what we do to prevent that. Planning, we have going to plan how to do. Rationally, why we have to plan, why we have to do that. Implementation, we are implying the planning. And evaluation. So this is my first nursing care plan. Second nursing care plan, we have to add the basic third year, second year, you have to write two or at least three. This is second. Patient C is having a severe headache. Is there he is having headache. And this was my last nursing care plan on the basis of C diagnosis. Here we write about the health education on the basis of diet, exercise, medication, and follow-ups. Here we have to write progress of the patient. It is a student personal experience, like what your personal experience after caring the patient. Conclusion as a part of my clinical posting. What like the conclusion of overall is a summary of the patient and his condition, and about the hypertension or nursing care plan, and is a bibliography. Like I read from the my book Algebra, the quick review series for BSc nursing second year, which was written by Anu Kaushik. It's a fourth edition, page number 331 to 336. Thank you so much. If you like my video, please follow me and subscribe me.